Hi, my name is Jennifer Wittick. I'm a physical therapist. A physical therapist works in many different settings, including hospitals, long-term care facilities, outpatient clinics, sometimes in the patient's home. As a physical therapist, we work with clients who, maybe due to illness or injury, they have lost some of their abilities and some of their function. And what we like to do is try to reach goals with those patients to regain some of that function. We often work with the caregivers or the families on safety issues and ways that that person can become as independent as possible. Now, another thing as a therapist that we are very involved in and concerned with is positioning of the clients. And that's what our topic today is positioning. What I'd like you to do to start this out is just to think in your mind of a time when you were on, say, a long trip in a car or a plane. Maybe you were real cramped and you weren't able to stretch your back or stretch out your knee, and just recall how uncomfortable that was. And I want you to keep that in the back of your mind as we talk about this, because the clients that you'll be working with when you're doing positioning helps with them are clients who are unable to stretch or reposition themselves. So keep that in your mind, that's an uncomfortable thing to not be able to position you on your own. Now, I want you to remember and be aware also that your clients need to be repositioned at least every 2 hours, sometimes more frequently. And if that seems like overkill or like that's a lot of repositioning, keep in mind that a healthy person like me or you, during an 8-hour night of sleep, changes our positions probably 30 to 50 times. And that's how often we change our positions so that we can feel comfortable. So that's something that your clients need from you, and that's very important for them if they are in a situation where they're in bed a lot and unable to adjust for themselves. Now, why is positioning important? Let's just think about the reasons why you may need to be in there changing their position for them very frequently. First of all, there's the integrity of the skin and the joints. Now, if skin has pressure on it for a long period of time, your skin will break down. And joints, if they're in a position where they can't be stretched or moved, they become very stiff, and they also can become contracted. And contracted joints and bones and tissues are difficult to work with. It's not only uncomfortable for the client, but you as a caregiver are going to have a hard time working with that patient and caring for them when they're not able to move in the best possible way. Another important reason that we do positioning changes with people is just to provide activity. Keep in mind that when you're not moving about, your circulation decreases, and that's going to decrease to all the areas of your body. Another thing is when you're not moving around, your muscles are not getting that activity and that contract, relax motion. Your muscles will start to atrophy or basically waste away. Also, when you're very sedentary or not moving much, it's very easy for secretions to collect in the lungs. And we know that that can bring about pneumonia, which can be very serious, especially in people who are elderly or disabled. Now, a third reason is basically just because it makes it much easier for any of the activities of daily living. We know that if you're going to go in and help a client with feeding or bathing, that you need to be able to change them to different positions. So that's just for the efficiency and the ease of what you do with your clients each day. And finally, a good reason for positioning is just for the client's comfort, and that certainly should not be considered least important. That's very important. Your client needs to feel that if they're in a position where they're stiff and not moving about, that they have somebody who will provide relief for them from pressure areas on their skin and from stiff joints. So client comfort's very important when we talk about positioning. I'd like to move along to preparing to position a client. When you're going to go into a client's room and you know that you're going to be doing a position change, just think about what types of things you'd like to have ready to go and about your safety for yourself and your client. If you're going to be dealing with a client alone, you need to have communicated with somebody prior to that. Communication between the caregivers is very important. If you're in a client's room, you need to know how often is this client being positioned differently. You might need to know if there's some reddened areas that somebody has been aware of, and you need to keep them off of those areas. So whether you're verbally communicating or whether you're reading treatment plans, both of those things are very important before you go into position a client. Also keep aware they may have oxygen tubing, catheter tubing, IVs. They may have special splints or braces that you need to apply after you change their position. So be aware of their needs. Now also be aware that if you need assistance when you're positioning a client, it's good to have that available and ready when you go into the client's room. If this is going to be a position change that requires more than just yourself, make sure that you have that other caregiver with you and ready to help you. Also equipment. Many times these patients have equipment that they need applied after the position change. Some of the things we've got here, you may have a trochanter roll. Now a trochanter roll is something as simple as a bath blanket that's rolled and it's placed along the side of the client's leg near the hip area, and what it does is it just provides support so that the leg is not externally rotating out to the side. So you roll the bath blanket and you place it firmly, snugly up against their leg so that it turns their leg into a position that's in alignment so that their feet are pointing up towards the ceiling and not rolled out to the side. Some other things you may have in the room are heel and elbow protectors. This is called a heel bow. You just apply that either to the heel or the elbow to help provide pressure relief from the surface of the bed. Here's just another device that would go on the heels that's lined with sheepskin. That also provides some relief and comfort from the hard surface of the bed. Occasionally you will see a patient, a client who's got an abductor wedge in their room. This is typically used on clients who have had a hip surgery, and after a hip surgery it's very important that the hips and the legs stay in alignment. So this abductor wedge is placed between their legs and kept on them sometimes all the time they're in the bed, sometimes only during a turn, depending on the care plan. But just so that you're aware, these pieces of equipment may be in the room, and when you do a position change, you need to be aware that they may need to be applied to your client. Safety, of course, is very important. We talk about safety with all of your work with clients. You want to be safe yourself and with your client. That includes good body mechanics. When you work with a patient in their bed, you want to make sure that the bed is at a proper position for your height so that you're not straining your back. You also want to make sure that if the side rails are going to be helpful for the patient to turn, that you've got the side rails up, and then if you're turning them to the side opposite from you, those side rails are there for their protection as well. So safety during your positioning change. Now explanation to your client. That's very, very important. I'd like you just to kind of think of two scenarios. Let's say you were the patient, you were the client in the bed, and somebody rushed in, pulled your pillows out, whipped your blankets off, flipped you onto your stomach, pulled the blankets back up and left. I'm sure that you wouldn't feel very well cared for. You probably wouldn't appreciate that very much at all. And just think of the difference if you walk into that client's room and you explain to them and talk with them and say, Mrs. Jones, this is Jennifer. I'm going to help you turn from your back to your side. We'd like to help you try to keep pressure off of your back and just change your position a little bit. I'll explain to you how we're going to do that, and I'll make sure that you're comfortable before I leave. And just think how much more reassuring that is for them, that they know what you're doing. The other thing is that it just gives them a sense of respect also, that you're caring about their feelings. So explaining to them and realizing that's not going to take you really any more time. You can talk as you're elevating or lowering the bed. You can talk to them as you're getting the equipment together. So it's not going to increase the amount of time it's taking you to care for that patient, but it makes a big difference to them. Privacy, of course, is very important as well. These patients, even though they are in a hospital or nursing facility, they need to feel that they're respected and that they deserve every bit of privacy, the same amount that we would expect in those situations. So if you're using a bath blanket or a sheet, whatever you need to, even if you need to grab another one, make sure that you keep them covered and that you're not exposing them when you're doing positioning changes. And finally, always adhere to a schedule. If there is an established schedule, it may be in the care plan. occasionally is on the wall of the patient's room, but be aware of that so that you know how often that patient is supposed to be turned or their position is to be changed, and into which position is the correct position for that time. Now, when you're positioning clients, there are just some basic body positions to be aware of, the positions that you will be using when you change them to different positions. One is prone, which means on your abdomen or lying flat on your stomach. Another one is supine, which is on your back. The third one is lateral, on your side. And the fourth one is Fowler's, which means a sitting up position. All of these body positions that you may put your clients in, you always need to be aware of their body alignment. You may change their position, but you need to be sure that no matter which of those positions they're in, that they are in correct alignment, that their body is in a straight line, that their joints are in proper relationship to the joints around them, so that hips, knees, ankles are all in good alignment and one isn't twisted or moved out of position, so that it's uncomfortable and so that it causes stress and strain on the joints and the tissues. I'd like you also just to be aware during the demonstrations that there are different turning methods. So watch for these. There is the use of the lift sheet, where you can use the lift sheet to help roll or turn the patient. There is the leg crossing method, and that's where you will have the client cross one ankle over the other, and that just assists with the rolling. They'll cross their ankle over the other one, then you will place your hand on their hip and their shoulder from the back and help them to roll. And the crossing the ankle just helps give some momentum in the correct position, the correct direction that they're rolling. Now, the last thing I'd like to mention before we do our demonstrations is that there are some extra care things that you can do, extra care measures when you are positioning your clients. One thing is a massage with lotion to their back and their pressure points. This does not have to be a long massage. I guarantee you your clients will be very, very appreciative for this if you take the time. But if you're turning them maybe from their back to their side, take a minute and just take some lotion, apply it to their back, apply it to the areas that may have had extra pressure on. Remember, they've been on those parts of their skin and their body for a couple of hours probably. So if you can take some lotion and just rub it into maybe the shoulder blades, the top of the shoulders, the tailbone where they've had pressure, maybe onto their heels and a little bit on their elbows, that will be very comforting to your client. And it also helps to just kind of give that circulation a jump start again after it's been decreased for a couple of hours. Also, of course, if you're changing their position and you notice that there are wet or soiled linens, you would change those. But also be aware of linens that have creases or that are bunched up. It's not only uncomfortable, but it's not good for the skin to be lying on linens that are creased or are uncomfortable in different areas to the skin. Oral care and offering fluids is another important thing. If you offer fluids every time you do a position change, that's a good way of knowing that these clients are getting enough fluid. It's also nice to offer them a chance to do some oral hygiene, some oral care. Many of these clients are on oxygen, which dries out the mouth. Many of them are mouth breathers, or they're on medication that's drying to the mouth. It's just nice to offer that so that they can have a chance to get their mouth cleaned and get some moisture in their mouth. And finally, toileting. That's a good time to offer toileting assistance. You would hate to come in and roll somebody onto their side and get them all positioned with pillows and braces and so that they're all comfortable, and then have them tell you, oh, but I need to use the bedpan. So that wouldn't really be their fault. You need to be aware that that's a good time to offer toileting so that you can take care of that before you put them into their final position. Now, I'd like to have you just watch closely as we demonstrate these positions for you.
Placing in supine position. Place the bed in a flat position. Place the client in the center of the bed and maintain privacy. Position the client's head near the head of the bed. Place a pillow under the head and several inches under the shoulders. Place a trochanter roll or other device to prevent external hip rotation. Place a pillow under the ankles to prevent pressure on the heels. Position feet at 90-degree angle against a footboard or pillows. Place arms at the side as the client wishes, with fingers extended. Placing in Fowler's position. Place a client in supine position in the bed with hips at the point where the mattress bends when the head of the bed is elevated. Elevate the head of the bed to 45 degrees, called semi-Fowler's position. Or 90 degrees, called high Fowler's position, as ordered. Adjust the pillow under the head for comfort. Place pillows under the arms to prevent shoulder strain. Place a pillow under the lower legs to lessen pressure on the heels. Flex the knee gouge slightly to keep the client from sliding down in bed. Orthopnic position. Position used with patients having difficulty breathing. Place the head of the bed in high Fowler's position. Lower the bed to its lowest position. Move the bedside table in front of the client. Place 1 to 2 pillows on the table for the client to rest on. Place additional pillows behind the back for support. Log rolling. Place the bed in flat position. Position the client in center of the bed on her back. Place the lifter sheet under the client unless already in position. Position 2 caregivers on the side opposite to which the client will face. Have the first caregiver adjust the hands under the head and shoulders. The second caregiver adjusts the hands under the hips and legs. The client's hands are folded over her chest. On the count of 3, move by sliding the client's face up and in unison near the edge of the bed. Place 1 or 2 pillows between the legs to keep the hips in alignment when turned. Raise the side rails and both caregivers move to the side of the bed where the client will be facing. Lower the side rail. Grasp the lifter sheet and place the hands at the head, chest, hips, and leg level of the lifter sheet. Have one caregiver count to 3, then turn the client onto her side as one unit in a single movement, keeping the spine, head, hips, and legs straight. One caregiver stabilizes the client while the second caregiver reaches for pillows to support the back, beneath the head, and to position the arms. Placing in lateral or side-lying position. Place the bed in flat position. Position the client close to the caregiver. Position the client on the left or right side using the crossing leg method, unless contraindicated. Position in the center of the bed with the spine straight. Place a pillow under the head, extending several inches under the shoulders. Place a pillow against the back to help maintain the side-lying position. Raise the side rail and move to the opposite side. Lower the side rail. Position the lower arm comfortably with the palm of the hand facing up and pressure taken off from the shoulder by pulling it slightly forward. Extend the upper arm or flex slightly to rest on the hip or forward and placed on a pillow. Be certain that the upper shoulder, arm, and hands are at the same level off from the bed. Place the pillow between the legs from the knee to the ankles or flex the top leg forward to rest on the pillow so that the hip, leg, and foot are about the same height off from the bed. Raise the side rails. Placing in prone position. Use this with caution in placing clients. It may not be advisable due to breathing or other problems. Check with the nurse before attempting. Place the bed in flat position. Pull the patient close to the caregiver. Turn the client on their side. Move to the opposite side of the bed. Remove the pillow from the head and place across the abdomen. Lower the side rail. With the lower arm above the head, turn the rest of the way onto the abdomen. Center in the bed. Position the client's spine straight with the toes over the edge of the bed or place a small pillow under the lower legs to prevent pressure on the toes. Place a small pillow under the client's head if desired. Extend or flex the arms for normal alignment as desired for comfort. Raise the side rails. Positioning in a wheelchair. Be certain that the wheelchair fits the size of the client. Lock the brakes. Position the client's buttocks and back against the back of the chair. Do not allow the knees to press against the edge of the chair. Make sure that the feet are resting on a footrest or flat on the floor. Place the trunk in balanced position, not leaning to one side. Use pillows to support if needed. Place arms on the armrest or on a pillow placed across the lap.
Now, finally, we'd like you to just remember that when you're done positioning your client, you need to do a final assessment or a good once-over before you leave the room. Make sure that you've checked all of the bony areas for any redness or evidence of pressure. Make sure that you've applied any adaptive equipment they have, including braces, splints, prostheses, or positioning aids, and make sure that they're applied correctly. Check to see that there are no skin surfaces touching each other that may lead to perspiration and breakdown of the skin. Look again to see that all the joints are in proper alignment. Check the linens to make sure that they're not too tight across the top of the toes. Make sure that you ask your client if they're comfortable and get their input. There's many times that they may need a slight adjustment and they'll be in that position for a couple of hours. So get their input regarding their comfort. Make sure that you've got the call light within reach for the client. Return the bed to the lowest position. And finally, record each of your repositionings and any important information that you need to communicate and pass on to the other caregivers.